New case numbers are down, deaths and hospitalizations are down, shot numbers are up. What does it mean? We ask Health and Human Services Secretary Dr. Mandy Cohen. Thank you for talking with us again, Secretary Cohen. Always good to hear from you. I know you have to be heartened a little bit with the decline in the number of new cases, decline in hospitalizations. Even our percent positive is going down some. The question I think all of us want to know is this just a blip in the road right now, or can we expect these numbers to continue to decline?
Well, first, Tom, always good to see you. And yes, I am very happy to see our trends moving in the right direction. You'll remember at the beginning of January, I was incredibly worried. We were at our highest levels of hospitalizations, and we were really working hard to maintain our hospital capacity. We saw our hospitals having to stop doing urgent, anything that wasn't urgent, they had to stop doing in terms of procedures. We were moving patients around. So we are in a much better shape, right? So we have some breathing room now, if you will, in our hospital capacity. We see our cases going down. I think we saw what we expected, which is a spike over the holidays. I mean, it started, with Thanksgiving, and it really never went down. It just went up with Christmas, up with New Year's. Luckily, we're past that now. The thing that concerns me, and folks have been hearing about, is the fact that we have new variants of the virus here in the country and here in the state. And so while our trends are going in the right direction, we definitely cannot let down our guard.
Well, talk about those variants a little bit, because a nice segue into my second question, by the way. The variants, we hear about the UK variant, the Africa variant. How noticeable do you find them in North Carolina now, and why should we be worried about those variants?
Well, first, there are a number of them, and it's not surprising. This virus does what it wants to do, which is change and adapt so it can keep spreading. And that's what we're seeing. And so what we're seeing for some of these variants is that they are more contagious, which means it will move even faster. And I want to step back for a second to talk about contagiousness of different viruses. It's interesting. We just put out data to remind folks that it's actually still flu season. Remember flu? Right. We don't talk about that. But actually, we're seeing very, very, very low levels of flu activity here in North Carolina and, frankly, around the country and around the world. And what it shows is that the preventive measures that we are taking for COVID are really working to prevent flu. And it just shows how much more contagious COVID is than flu, because we see it, COVID is still spreading. We still have thousands of cases every single day when we're not having any flu cases, right? And so it shows how much more contagious COVID is. But now we have these variants that are even more contagious, and that does obviously make me concerned. But I will say it's still the minority of the cases that we are seeing. I think we've identified between 20 and 25 folks who have had one of the UK variants here in North Carolina. We have not identified in North Carolina the other variants, but we are acting as if they are here. They're not dominant, but they're here, and it does mean that we have to keep doing the things we know work. The 3 W's do work. If we weren't doing them, we would be in so much worse shape than we are. And I think the comparison to the flu numbers shows us we are doing prevention. It is working, but we have to keep our guard up and keep doing it.
There was one piece of sad news that you reported at your press conference on Tuesday, and that was we've passed the milestone of 10,000 deaths in North Carolina. And you said that most of those, in fact, 83% of those deaths came from people who were 65 and older. When we look at the decrease in the number of hospitalizations, we also know hospitalizations equate too often to deaths. So that's sad news for people. But it does show why we are emphasizing getting these shots to people over 65, right?
No, that's exactly right, Tom. Yeah, it's a sobering number to cross 10,000 deaths. Just in comparison, in a normal, even bad flu season, we are between 200 and 300 deaths from flu. That's a bad flu season for us. We're at 10,000 deaths in one season, if you will. And again, it's been a very long year of a season, and because it's the first year of this, we don't really have any seasonality. But 10,000 deaths in less than a year is a sobering statistic and reminds us how deadly this virus can be. But you are right, it is really our folks who are over 65 who are being worst impacted by this, and it's exactly why we are focused on vaccinating those who are 65 and up in this first round of vaccinations, and we're doing a good job. We are reaching our that population quite well. Actually, we're a bit over 50% reached in the 75 plus, and about 40 or so in the 65 to 75 range, and so we're doing a good job. But we have a lot more to do. We know that there is a lot of demand out there for those who are 65 up who want vaccines and haven't gotten it yet.
It feels like we're in a race. How fast can we go to get vaccine in people's arms, because the variants and the virus are also dangerous enough to speed up numbers of cases, which we want to keep down. Is that a fairly accurate description of race?
Well, it is, but unfortunately we are slowed down in the race by the supply of the vaccine. So it's not that we can't get the shots in arms fast enough, because actually our vaccine providers could probably do 3 times the amount of vaccinating that they're able to do because of supply. They tell us week over week, give us more, we can do more, which is, we're so lucky in North Carolina that that's the position we're in. We just don't have the supply to give them. We are only getting about 150,000 first doses week over week, but we know the demand is much higher than that, and we know our capacity to give those vaccines is higher. So it is frustrating that we don't have more supply. So it hobbles us in that race that you were talking about. We do want to get vaccine out quickly, but we need more supply. And I know the federal government's working on it, and the Biden administration's actually done a great job. Week over week, they've actually given us more each week, but it's 5% more, 10% more. We're still in small numbers here. So I'm looking forward to hopefully this next vaccine that is being reviewed by the FDA right now, a Johnson & Johnson vaccine. Right. So I think that's the next thing that will help with the supply side.
I want to talk about an announcement that you made on Wednesday, but before I do that, you spent a fair amount of time in your Tuesday press conference talking about the efforts to try to increase the number of vaccinations with people of color. Charles Evans, the head of the Black County Commissioners Association of North Carolina, was with you, and he said that the African Americans account for 22% of our population, but had only had 13% of the vaccinations to date. First, is that number fairly accurate? What is it that you're doing to try to increase this?
Yes, well, the numbers are accurate, and folks can look on our dashboard and see our race ethnicity data by state as well as by county. So you should go and look at that data for yourself. And yes, they are 22% of the population getting about 13% of our vaccines, but I would say that we've made a lot of progress. What we saw in the middle of January is we were closer to 10%. What we've seen week over week, we were about 10%. Actually, in the last week, we got up to 18% of our weekly vaccines were administered to those who are African American. So that we're making progress, and but we have a lot more work to do, as the chairman mentioned yesterday when we had that press conference. And so we're doing it in a lot of ways. First, it starts with allocating the vaccine. We got to make sure it's getting to every community, all 100 counties. And we're giving an increase in vaccine for our vaccine providers that are administering to those who are 65 and older and have a higher percentage of minority communities in the area that they serve. So that's the start. Then we also use some of our vaccine allocation for special events, but those special events need to target our underserved communities for us to support them. And so our providers have done a great job at this. Now, we have more work to do. I shared a number of examples yesterday at the press conference in all parts of the state where they're using different mechanisms and tactics to reach. Sometimes it's partnering with a local church.
Yeah.
Sometimes it's holding back appointments and saying, nope, 30% of our appointments today are going to be for our African American, Hispanic, Latinx population. Other times it's mobile units. So there's a lot of different ways in which folks are getting at this, and we want to be supportive of all of those partnerships across the state, and I think we're making progress.
Chairman Evans referred to the fact that, of course, in many instances, these minorities, the black and brown communities, are underserved so far as health care issues anyway. But he also spent a fair amount of time talking about the reluctance of people of color, and the distrust many of them have toward these vaccines. He had a very strong message trying to encourage minority communities to take the shots. What else are you doing to try to encourage that?
Sure. Well, first, it's about getting good information out. And not just the information, but it's the messengers. That's why it was so important for Commissioner Evans to be with us, because I'm sharing good information, but it's important for folks to hear from a lot of different trusted voices on about the vaccine and about folks' willingness to get the vaccine. So, for example, we have more than 30 PSAs now that are recorded of prominent African American leaders, pastors, and others who have rolled up their sleeve to get their shot. They talk about why they're doing it. And actually, we've already talked with first responders who are from the African American community, Hispanic, Latinx, to share their stories. I think the messenger is really important here. But I want to caution us that, the Black leaders have cautioned me to make sure that we're not saying hesitancy is the reason we're not seeing the numbers here. There is demand in the African American community for vaccines, and we have to work hard to make sure that we are meeting people where they are, earning their trust, and also making vaccine accessible to them.
You made a significant announcement on Wednesday afternoon in your press conference. Share the information with us.
Yeah, well, first, I would say that we know that the announcement is really based on the fact that our supply of vaccine is really low still, as we keep talking about. Our vaccine providers could do more, just our supply is low, and we still have a lot of work to do in vaccinating those who are 65. So what we announced today is that 2 weeks from today, starting on February 24th, is when we're going to start vaccinating our frontline essential workers. But we also know, again, because of that supply, that is a big group of folks, right? It is our teachers, our police officers, our clergy, our firefighters. It's a very, very big group. And we definitely heard from our vaccine providers saying, look, supply is so low. This group is so big. We need to figure out a way to sort of step through this. And so we did announce today that we are going to start stepping through our group of frontline essential workers, starting with our childcare, folks who work in childcare, and those who are pre-K to 12 teachers and the personnel who work in our schools, our bus drivers or cafeteria staff. So that's still a huge group of folks to get through, but I think will help us as we're in this moment of limited supply. And I'm hoping by March 10th, when we hope to move forward with other frontline workers, that we will both have more supply and maybe even a third vaccine.
Yeah, I guess my question to all of that is, we're still hearing an awful lot of people who are 65 and older talking about the difficulty they're having trying to get appointments. Now in 2 weeks, we're going to open this up to group 3, so to speak. How's that going to work out? I mean, we've administered about 1.4 million doses of vaccines so far, which is a good number, but our population is around 11 million, so there's a lot to be done there.
We have work to do.
Yeah, a lot of work to do. So how is all of this going to work out? I mean, we're getting 150,000 doses per week. You announced Tuesday we're getting another 5% bump. It looks like we got a supply and demand problem here.
We do, Tom. We just do have a supply and demand problem. We have more demand and not enough supply. Well, and that is exactly why we said, look, we have to give it another 2 weeks before we can move to frontline essential workers. We do have big demand for vaccine and those who are 65 and up. Again, the reason we started with them, that is where folks are affected in terms of death and hospitalization. So we definitely want to prioritize. And what I would say, yes, we will move on. It will be the earliest that our vaccine providers can move, but I want to encourage folks to say, you are absolutely right. We're going to keep vaccinating those who are 65 plus. So it's not like the door shuts on them. The door remains open. We will add, and it will take time to add the teachers, add the childcare workers, add our bus drivers and cafeteria, right? It will take time. So it's not all on February 24th are we ever going to be able to get to everyone, even in that group. So it is frustrating, I know it, but it is also the reason, Tom, and I want to point this out specifically, that getting vaccinated for our teachers is not a prerequisite for getting back in the classroom. And I want to make that point really clear. The data continues to show that if we use the safety protocols, masks, washing down surfaces, the screening protocols, the social distancing, that schools are actually low transmission settings, and that's good. So we want to see our kids back in the classroom. I know our teachers want to get back into the classroom. I want to get them vaccines as quickly as we can, but we know the supply is limited. So that is not something we need to wait for in order to get back into the classroom. So I wanted to make sure I made that point. But again, we want to get them vaccine as quickly as possible, but that can't be a prerequisite for getting back in the classroom. And frankly, the data shows us it doesn't need to be. We need to follow the protocols. The protocols won't change. So I think that's what we're going to continue to focus on.
The legislature is getting ready to pass a bill which requires kids to go back to class. Now, there are different criteria for elementary school kids versus middle and high school kids. Talk about that a little bit.
Yeah, it's a really good point because right now I don't believe the legislation distinguishes this point. For our middle and high school folks, we really think it's important to maintain the 6 feet of social distance. This is because in middle and high school, viral transmission seems to be the closest to what we see in adults. Under the age of 10 or in elementary age students, it does seem to have less viral transmission. And that is where we were saying, that is where less than 6 feet of social distance can be okay. And we have studied it. And we can show that even with less than 6 feet of social distance, that we don't see the viral transmission. But we do think there is a difference between elementary, middle, and high school. And so I want to make sure folks understand that for middle and high school, just because we're saying 6 feet of social distance doesn't necessarily mean automatically they can't be in school every day, because every middle and high school has a different physical layout. Right. So if the school is big enough, or frankly enough students have opted for virtual learning, it may be possible to bring all of the kids back every day and not have to go to hybrid, even in middle and high school, as long as you can maintain the 6 feet of social distance. But that is an important distinction here that we have made.
Without getting into the politics of it, it seems to me like each school system, maybe even each school, is going to have to make a case-by-case determination themselves about how they're going to be able to carry off these safety protocols without having just an absolute mandate. You got to go start back in schools. Do you think
I think we're all on the same page of saying that there is a way to get kids back in school, elementary, middle, and high school. There are protocols that work that everyone can be in in-person school right now. So I think we're all on the same page and moving in the same direction. I think the way we get there is slightly different. I'd like to see folks make sure that they are maintaining our protocols, because those are the ones that were studied.
Based on the demand that you're seeing right now, going back to vaccinations, based on the demand that you're seeing, how many doses would we need? You said we're getting 150,000 a week, getting ready to increase it by 5%, hopefully more, particularly when the new Johnson & Johnson vaccine comes out, which looks like it's more and more probable. How many doses do we need a week? How many should we have?
Oh, it's a great question. Well, so remember the two vaccines we have now are 2 doses, right? Johnson & Johnson is going to be a one-dose vaccine. That could be game changer, right? With having just one vaccine, I think both operationally is easier. It actually doesn't have the storage requirements. So I think there's a lot of benefits to the hopefully coming Johnson & Johnson vaccine that we're going to see. But essentially, look at, we have 8.5 million adults here in North Carolina. Remember, the vaccines are not yet authorized for anyone under the age of 16. So looking at 8.5 million, and if everyone needed the 2-dose regimen, obviously we need about 17 million vaccines here. So it's easy to do the math. 150,000 at a clip doesn't get us as far as we need to. Again, those are 150,000 first doses. So doing the math, you need to get to, about 8.5 million. So we know that there is more capacity coming. We have heard from the federal government that they've both purchased more of these first 2 doses, the Pfizer and Moderna, but it's not coming probably until there is another increase likely coming in April, and then another increase likely coming in July. So those are the time periods they have said out loud. And then there's maybe a Johnson & Johnson, maybe there's an AstraZeneca vaccine. So I do hope that by the summer, by July and August, that we will have vaccine more widely available to those that want it. But you can see that right now we just are limited by supply.
And people are still expressing frustration, as I said before. But last week you announced you were opening up a new call center, a statewide call center. Talk to us about that and how that's working. If I want to get vaccinated and I live in one county, can I call this call center and get an appointment through them?
So the call center is great, but it doesn't make appointments for you. That's its limitation. So no appointments to the call center, but it can tell you where are your vaccine providers, what group are you in, answer questions about the vaccine, and it can direct you to the place to make an appointment. We are looking at options for scheduling in a more organized way, but right now that wasn't something that we have to offer.
Okay. Along those lines, the governor announced on Tuesday that he was setting up some new executive directives. Candidly, I got a little confused about exactly what it was and what it means. Can you explain it to us?
Yeah, there are a couple of pieces in it. Really what it says, it frankly was giving me and my department the authority to bring on additional vaccinating providers and to give some flexibility there. So particularly the way our state laws were written, dentists, for example, could not be a vaccinating provider, where clearly they're medical professionals. They could give vaccine. What I shared yesterday in the press conference is we're actually not short on vaccine givers. We're short on the vaccine itself. And so while it's helpful to we want to have all of these flexibilities in place because we want to make sure that we have vaccine providers at the ready with the understanding that supply is going to increase. So we are trying to build that capacity, sort of waiting in the wings, if you will, for when the supply increases. So the executive order is really more to help lay some groundwork for future months when we know we have to increase our capacity to vaccinate even more.
We got about 2 minutes left in show. I want to talk about the fact that Walgreens has announced that at 300 locations in North Carolina, they're going to begin giving shots. Harris Teeter says they're going to begin giving shots. I guess the question a lot of people are asking is, are these vaccines coming from our allocation in North Carolina, or are these additional allocations going to them?
Yeah, it's a great question. It's a bit confusing. So we have a state allocation, but actually the Walgreens program is coming separate. So we have our allocation, but the Walgreens is from a federal retail pharmacy program. So it's over and above what we get for the state, which is good, which means more vaccine is coming. But I'd caution you to say, right now, the supply even is very low in all of their stores. They're only getting about 100 vaccines a week in each of those 300 stores. So, it is going to take some time. Again, they have limited supply. Everywhere has limited supply. But I will say a team member of mine signed up, who's over 65, signed up to get their vaccination at a Walgreens over the weekend. So the online portal is working for them. It did crash yesterday, but it's back up. And so it's a
supply and demand
so
problem.
Folks are,
Yeah.
Exactly.
Okay.
It's everywhere.
Going forward, what's your big concern? What's your big hope?
Well, I'm concerned about not having enough vaccine supply, and I'm also concerned that folks are hearing so much about vaccine that they're going to let down their guard on the 3 Ws. I think those are my two big concerns. We don't have enough vaccine, and folks are saying, "Oh, I'm done with the 3 Ws." That's a recipe for concern. So what I would say is we're all going to have to be, waiting on that additional vaccine supply. It's going to be in the summer till it's widely available. And we have those new variants out there, so we cannot let down our guard on the 3 Ws. So thank you to everyone who's wearing a mask, waiting 6 feet apart, washing your hands. That's going to continue to need to be our way of moving through the world until we are able to build up enough vaccine supply for everyone.
Help is on the way, but even if you've had your shots, you can't let down.
Yeah, but the hopeful note is vaccine is here. It's amazing that we have 2 vaccines already, that we've gotten out 1.4 million doses. So, we are definitely making a dent in beating back this pandemic. We just have to stick with it, and we will get through this.
And keep those 3 Ws going. Secretary, it's
That's
always good to talk to you, and we appreciate you spending time with us and helping us to be able to understand more about what's going on. We thank you and your team for the job that they're doing, and also all these healthcare workers across the state. We're going to have another scheduled interview with you on February 24th, the day that you begin those new protocols. But here's a little bit about what our viewers are going to be able to see next week on COVID Uncovered.
What we have to do is to model our response based on the adult data that we have.
There's limited data on how to treat COVID-19 in children, how doctors are finding new ways to care for their young patients.
Quality Public Television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting PBS-NC.